My name is Willieford Moses. I am an assistant professor in the Division of Pediatric Surgery, which is part of the Department of General Surgery. In that capacity, I serve as one of the surgical oncologists who focuses on the complex management of oncologic diseases and conditions within the pediatric population. I work predominantly at the Children's Hospital Oakland, but I also take care of patients at BNF Children's Hospital at Mission Bay in San Francisco. I also have academic interests, which focus around two areas, one, medical education, and the second one, device equity. In those capacities, I work as one of the curricular liaisons for the Anti-Oppressive Curriculum Initiative. Then I also focus my interest in device equity around innovation and attempting to identify tools and instruments that can be applicable to the resource-constrained setting to improve access and equity within healthcare. So what excites me most about my role here at UCSF is that I have an amazing opportunity and frankly a privilege to take care of patients in their most vulnerable settings. Obviously, as a pediatric surgeon, there will be an obvious and clear understanding, as most would have, of that vulnerability, but also within the notion that many of the patients that I care for may not have access to other surgeons, other doctors, other resources, and thus I have the opportunity to fill a gap that exists. So it's an incredible opportunity to work with patients in settings in which there is vulnerability, because by providing care, and particularly if it can be done in an equitable fashion to those in resource abundant settings, I feel that I'm fulfilling a gap and a need that otherwise would not be fulfilled. And it's very gratifying to be able to look at patients and to know that they have fortunately benefited from not just the care that I've provided, but the team in which I work, and that assuming we have great outcomes, these patients go on and live amazing lives in which they're not limited by health conditions that unfortunately are often impacted by the limitations and disparities that exist within our society. Essentially, from the time that I made a decision to become a doctor, it was focused on the need to help those that were of limited resources, whether that was vulnerable patient populations here in the United States or through my interest in global health and in resource-constrained settings and countries. And so with that focus, essentially from medical school through residency and now as an attending surgeon, my interests have been in identifying vulnerable populations and trying to determine in what ways I can potentially improve their access to care, improve the delivery of that care, or create de novo devices or therapeutics that meet them within that vulnerable patient and or resource-constrained setting. And so I would say uniformly my interests focus around that. While certainly there is the applicability in resource, aplenty settings in which they have abundance of resources, and hopefully my interventions will help those patients as well. But specifically, my focus from the very beginning has been on identifying those vulnerable populations and trying to determine in what ways we can improve the care we deliver to them. So being named a John Watson Scholar has been an incredible privilege, and I approach it with humility and knowing that I follow in the line of tremendous researchers, and I recognize the role that this can have in my early career development, and allowing me to essentially through seed funding and resources develop my projects in a way that ultimately can have significant impact. Looking at the impressive list of previous scholars is humbling, and knowing that I was selected to be one of them, and a recognition that my early work has been identified as having potential to, again, have long-lasting impact. I feel incredibly privileged to be a part of this group, and in particular to recognize the tremendous success that many of the prior scholars have had. It's both to a degree intimidating, but also motivating, and it's exciting because I know that through the resources and the expertise and mentorship, I will have essentially a significant amount of resources to aid in both my academic interests, but also my focus around clinical care and patients.